Hi everyone. Hope everyone is doing well. Happy New Year to everyone out there who came to the provider meeting. I know you're wondering, why is Alvin on video? Well, unfortunately, I'm on video because I can't be at the meeting because I had a death in the family and I have to go to a funeral. Sorry I can't be there in person. I will be at the next meeting, but I just want to make sure that I can personally tell everybody how well a job that they're doing. I've been at the different health centers and I've been watching and I've been looking at some of the charts and very impressed with the job that a lot of the providers are doing in the PHMC network. So I just wanted to congratulate everybody. Also, just wanted to tell you, just keep on pushing, keep on doing the good job that you're doing, and don't get discouraged. It's being noted that you're doing a good job and that we're very proud of what we stand for here at the PHMC Network. We're one of the fewer organizations that actually has a JCO accreditation in a health center. You don't see that. That is very rare. So for us to have that designation at all of our health centers is a great thing, and it just goes to the work that we've done in having a higher level of care that we provide for our patients. So again, congratulations. These provider meetings are very important, and I encourage people to come on. I know some people can't make it, but it's very important to make it so that you can have an opportunity to hear the information that we are going to share. There's a lot of different information and things that are coming down the pike, so we want to make everybody aware of those things. But it's also an opportunity for people to convey, some of the things that they have. Share information as far as best practices and so forth. And every health center doesn't practice the same. So we get an opportunity to hear from people that we may not usually hear from, and they could actually impart some good information that we could take. And that's one of the major things that I think that these provider meetings provide for all of us. So please, I encourage everyone to come and tell the other providers to come as well too. These meetings, we want to have it start around this time, 2 o'clock, so that everyone can have an opportunity to use some of their admin time, whether it's to make phone calls or finish up some notes or do anything that they need to do, and then come on to the meeting so that we can get started. Not trying to keep you long, but we're trying to just have a really good and productive meeting. The other part is that we want to take the show on the road. We don't want to just have it here at 1500. We want to go to Congresso, Health Connections, Care Clinic, Rising Sun, Mary Howard. Go to all the other health centers to have these meetings hosted there so that we could get an opportunity to not only see how others practice, but just get a better understanding of how they perform their job. And hopefully from that you can take something from it and be a better clinician. So I encourage people to continue to come to these meetings. One of the other things that is important too is we're going to start to have a provider performance data. And what that basically is an opportunity for providers to be measured so that we know how well we're doing. A lot of times, you just go to work and you're seeing patients, but you really don't know how well you're doing. So now this is an opportunity through UDS data and through meaningful use data for all of the providers to get an opportunity to see how well they're doing by use of that data. So the UDS, that's the Uniform Data System that we report to HRSA, making sure that we're doing what we are supposed to do for our patients. Getting hemoglobin A1Cs for our diabetics, getting colonoscopies for those patients over 50, all those sorts of things. So that goes into a provider's performance data, and they'll get a report, and that report will show where you're deficient or where you're doing really good in certain areas. Also will let you know about where you stand in meaningful use and where you may need to improve in attaining the goals in the meaningful use. Number three, I wanted to talk about opioid updates. We all know about the deaths of overdoses, in regards to people on the opioid medications. And, compared to what we saw in 2013, 2016, we had over a 50% increase in these deaths. And as a result, this isn't just in Philadelphia, but it's across the nation. The CDC has spoken to us and said, hey, your primary care providers have to limit the amount of opioid medications because people are getting addicted and people are overdosing on these medicines. And to help with this cause, please try to limit the amount of opioid prescriptions. And that's what we're trying to do at PHMC. So I encourage people to do that. We, as everyone knows, we were trying to develop our whole pain medication guidelines, and it's really set around that based upon what the CDC has said to us in limiting those opioid medications. One of the other things that was put out was that the Health Partners Medicare, they actually decided that they were going to limit the amount of pain medicines that they are given to their members. So I see this as a precedent that could be set, and you may see other insurance providers doing the same thing, where they may set limits as to the amount of medication, opioid medication. Now, I said Health Partners Medicare, so that's a little different, than straight Health Partners. But Health Partners Medicare, they are limiting the amount of opioid prescriptions for their members. So if you have a patient that's on that, just be mindful about that. One of the things that when we are prescribing medicines for our patients that have opioids, if you may still have patients that are taking opioids for a chronic reason. We have to continue to document the reason why they are on those medications so that we can justify. The other thing is to prescribe Narcan. That is something you want to educate the patients about if there is an overdose, that somebody can administer the Narcan, or if they can administer it themselves, depending on how they're feeling. But that's another thing that is advised, is to give a prescription of Narcan to those patients. And of course, we want to check the prescribing drug monitoring program. We always want to check that before you prescribe an opioid or even a benzo. I personally was, someone pulled the wool over my eyes a couple weeks ago. I didn't realize that I had put a refill on one of my benzo prescriptions, and I gave them another prescription. And when I looked at the drug monitoring program, I actually was able to see that they had two prescriptions on the same day, and only wrote it one time. But you see, the one was a refill and the other was a new prescription, and they got the medicine filled at two different pharmacies, and they paid cash for the other. So be very mindful, be very careful, of things like that, because, patients, sometimes, they get bright ideas and do things that they're not supposed to do. So just be very careful of that. Of course, we want to make sure patients have urine drug screens, and we also want to make sure we have a contract on in the EMR system. And it's the standard drug contract that basically, tells the patient that, they are held to a certain standard when they're on these medicines, and if they don't abide by that standard, the medication can be taken away. Really plain and short, and that they are open to a random drug screen test at any time. If patients, we have patients sign that, and if it's on the chart, we can always reference that when we think that the patients may not be doing right, and then we'll be justified in taking them off the medicine if it comes to that. There also is something I want to push out, and because if you do take a patient off of opioid medicine, and let's say that they were taking it, on a regular basis, there are certain things you want to make sure you look for as far as withdrawal symptoms if they are experiencing, because withdrawal from an opioid can be particularly dangerous, as well as withdrawal from a benzo. So we want to be careful that if these patients are taking them on a regular basis, and then we try to pull back, that no harm is done in that way as well too. So we just want to be very protective of our patients, but at the same time, just not prescribing medicines and not monitoring the way that we should. We are going to be having a meeting soon on our PHMC pain medication guidelines. That meeting is going to be at the Care Clinic on January 27th at 2 p.m. So please come out. The more the merrier, so that we can finish these guidelines, and so that providers can have they can have a guide as to how they could prescribe these medicines, and we can all be on the same page in regards to our prescription of opioid medications. One of the other things that we're trying to do is have the Pain Academy. We're starting that at Care Clinic, and basically it's just another modality to help patients in dealing with pain. They're going to see, they have to see a behavioral health specialist, and in seeing that specialist, that is going to be in the pain contract as well too, that they have to have that meeting. So we need to look for other means of treating the pain, and not just pain medication, whether it's physical therapy or sending them to the pain specialist for injections. But we have to educate our patients, and this is what the Pain Academy would do with our patients. So that's really it, everybody. I hope I didn't bore you too much. We'll see you next time. And like I said, we're taking the show on the road. We're going to have this provider meeting at another location next month. We are going to have a prep education, and we're going to have other trainings, in the month as well too. And we're going to have CME for those trainings. Thank you, everybody, and I'll see you next time.